The honourable member for Fadden now has the call.
Thank you, Mr Deputy Speaker. Recently, the Minister for Health wrote to me and asked my comment about whether I'd be amenable to a GP Superclinic in the northern part of the Gold Coast. After consultation with all of the medical clinics in Fadden throughout the electorate, the feedback I have received and a 100% response from the feedback I've received is that no GP Superclinic is warranted nor required in the electorate of Fadden. A recent general practice Gold Coast census of GPs shows there are 473 GPs and 215 nurses in 123 practices across the Gold Coast. The age and distribution of the workforce remains relatively constant, with clinicians coming on board in sufficient numbers to replace retiring GPs, though DWSs are required to expand. What's not required is another superclinic which would simply rob Peter to pay Paul, because the real problem is the shortage of doctors. This shortage continues to be exacerbated by the Department of Health and Ageing not allowing district of workforce shortages to be applied in the fastest growing electorate in the nation. GPs have changed work practices to become more efficient, to increase the capacity of general practice and to systematise it for more effective service delivery. General practices in the Gold Coast are already super clinics, and every single one of those general practices sends a very clear message. They don't want the government interfering. They don't want a super clinic. The Labor government does not know better than the GP clinics on the Gold Coast. The simple response for them to the government is butt out. Leave the Gold Coast clinics to do what they do best, provide medical care. General practice on the Gold Coast has successfully created medical homes in their local communities where patients can access a doctor of their choice in their own area. There is no unmet need in Fadden that a great big shiny building that will help from the Labor Party. In the last 3 months alone, 3 new medical practices have opened in Fadden and many businesses have extended their opening hours. There are now local practices providing services until 10 p.m. at night and all day Saturday and Sunday. The population is also served by several out-of-hour agencies who provide both home visits and surgery-based consultations. So therefore the question is, what value does the Labor Party super GP clinics bring, apart from a shiny new building for one of their senators to open? A super clinic is totally and completely unnecessary on the Gold Coast in Fadden. It is not warranted. It is not welcome. Fadden is well serviced by existing general practices. The super clinic model proposed by the Labor government will destroy the medical homes which already exist and do very little for patient care. Now, the government obviously thinks so, because they won't allow greater district of workforce shortage doctors in. Therefore, they're already saying by that action that there is already sufficient medical care.